Welcome to the Trilogy Talks Health Show, sponsored by Trilogy Home Healthcare. The home health experts at Trilogy specialize in meeting the needs of each of our patients. Our experienced staff provides services such as skilled nursing, physical therapy, occupational therapy, speech therapy, psychiatric nursing, respiratory therapy, and more. With our Florida offices stretching from Hollywood to Jacksonville, Trilogy can take care of all of your Medicare home health needs. You are our family. For more information, call us today at 954-689-6660.
Hi, I'm Tony Brown, and welcome to Trilogy Talks Health. Today's topic is social isolation on older adults. Today we have three very special guests that are going to talk about the effects on social isolation in the community. First up, we have Dr. Raymond Ownby, Professor Chair at Southeastern University of the Psychiatric and Behavioral Medicine Department. Thank you, Dr. Ownby, for joining us today.
Hi, it's a pleasure to be here.
We also have Dr. Carline Oyadiran, the Medical Director at Sanitas Medical Centers in Doral. How are you?
Nice to be here.
Thank you for coming. We appreciate you having you here. And last but not least, we have Dr. Excuse me. I made you a doctor, Teri. We have Teri Karst, Director of Community Relations at Artis of Senior Living in Davie. So let's get right to it. Dr. Ownby, we're 9 months into the pandemic, and everyone's talking about isolation, but this isn't a new conversation. Can you tell me what the difference of amount of people that are suffering from this from then versus in 2020?
Well, certainly social isolation has often been recognized as a problem among older adults and the elderly. As people age, their life roles change. There are fewer opportunities for socialization, particularly after retirement. There are often big changes in people's ability to have regular contacts. And now with the COVID pandemic, of course, a lot of the things that people could do, participation in community groups, even just going shopping, casual acquaintances, saying hi to people in the street, a lot of that has become much harder to do. So there's been really a dramatic increase in social isolation over the last 8-9 months.
Got it. Thank you. And are there is there a specific demographic of people that are impacted by this? Dr. Carline, you can jump in on that.
Senior population, as Dr. Ownby mentioned, are at risk because they are the highest risk for having COVID-19. So they've been told to pretty much lay low and try to avoid being out in the community, which isolates them. And in addition to the fact that some seniors have lost, it may be a wife or spouse and may live alone, and they might be forgotten. So those are the people that we need to reach out to and try to engage and find out what their needs are.
And do you have programs, as the medical director at Sanitas, do you have programs that focus on that?
Yes, we just started a program in October, which we are working with our patients as they come in, and we are doing a Lubin study, which is a survey to find out if they're socially isolated or lonely. And in that survey, there are 3 pointed questions. Do you have someone to talk to in your family or friends within the last month? Do you also have someone that you can talk something privately about? Or do you have someone that you can call for help? And if those patients answer that they are missing those 3 components, we identify them as being lonely and have processes by which we try to secure some community services for them. The result of that has been impactful in that our doctors and our staff are learning more about social determinants of health and how to really incorporate the social aspect of care and the community approach. So I think that has opened our eyes as to how many patients truly need our help, other than just the medical care, but with the social as well.
Thank you so much. And Dr. Ownby, just to kind of, piggyback on that, are there certain demographics that you see in your research that are affected more than others?
Well, absolutely. The people who are perhaps socioeconomically less well off, have fewer resources, and are less tech savvy, are much more likely to be experiencing loneliness and that social isolation, because it's harder for them to maintain contacts. So certainly many upper middle class folks may have technological resources to use to maintain contact with family who may be distant, and more frequently with friends and things, and other people, as well as social groups that are actually meeting online.
Got it. And Teri, you're out there, you meet with families on a regular basis. Tell me how this affects working with the different families, and how it affects the decision-making process when they're thinking about coming to a family member, having a family member come to Artis.
It's interesting, Tony, as an assisted living, caring only for those with Alzheimer's and dementia, families come to us pre-COVID with the idea that they want to know about social engagement and socialization. And with the pandemic, the families have kept their loved ones at home because of the fear of the virus and because they were not allowed to visit with their loved ones. Assisted livings had locked down for many months and did not allow any contact in terms of face-to-face visits. So families have decided to keep their loved ones at home. And as a result, these family members with Alzheimer's and dementia have suffered from social isolation because they can't go out, they can't go see their friends, they can't go to the mall, they can't do any of these things. And what their family members are seeing is that they are lonely and that they're depressed and that they are not physically active and they lack stimulation.
Got it. Thank you. Yeah, we're definitely seeing our nurses at Trilogy Home Health are seeing the same thing, and families that want to keep them, safe at home for the time being. Now, Teri, can you give me an example of we were talking the other day, and you shared a story with me, and I really thought that would be a perfect time. Can you share that with us?
Yes, of course. I have a very, very dear friend, Joyce, who is about 85 years old. We've been friends for about 20 years. She was working in a very important position until her mid-70s, and retired and moved to be closer to her children in Maryland. Last year, she was diagnosed with dementia. In any conversation pre-COVID, she would be repeating herself 2 or 3 times. I spoke to her Monday and mentioned to her that we were doing this podcast and asked for her input because she is very high functioning. And I said, have you felt any effect from being socially isolated? And she said, yes, I'm bored. She said, first of all, I'm very grateful to be with my family. I have a lot to be thankful for. So she's still her very positive self. Mm-hmm. But she said, I'm bored. I stay in bed longer because the days are very long. And if I get up earlier, then I have to face more of the day. And she said, I might even be a little bit depressed. What I found interesting was that she repeated herself 9 or 10 times in this conversation. And I know that that's a direct result of being involved in this COVID situation.
Got it. Thank you for that.
Definitely interesting.
Yeah, what were we gonna say, Doctor?
Yes, one of the things that happen in patients who are socially isolated is it impacts on their memory, their mental and physical wellness as well. So the fact that they've been isolated also makes the dementia probably exacerbate than what it would have been if they've been more in contact with others. In particular, in your case with your friend, she lived at home, so she was not alone. So it's probably a little bit better than most that live alone.
Yeah, that's actually a perfect segue. I was getting ready to ask Dr. Ownby, what do you think the long-term and short-term psychological effects of being isolated have on folks?
Well, I think it's we've already highlighted several of the most important aspects. Certainly, short-term people may become apathetic. They may not feel like doing things. That can, eventually turn into a full-blown depression. But in addition, it's been shown that the social isolation is associated, as Teri was mentioning about, unfortunately, with her friend, is associated with further cognitive decline. And even the risk of cognitive decline in people who may not already be experiencing cognitive difficulties.
Wow. And so, I'm going to call you Dr. Carline. Dr. Carline, have you seen it specifically in your centers affecting their health, like in a decline, like?
So yes, we've had a few patients, and one patient in particular that really touched our hearts, which is a gentleman who came in, and he came in for the first time. He was a brand new patient, and we did the survey, and he really flagged out as someone who was lonely. But when the thing is that when we discovered that, we found out that he moved from one plan to another. He's been moving around from town to town, and he just recently retired. So he has no social network and no friends. So he truly was depressed as a result of being so isolated, but also of not having a network and just establishing relationships with our providers. So one of the things it highlights is our physicians to be more keen to doing that type of evaluation as it relates to the loneliness, but also with the PHQ-2, checking for depression and anxiety, because isolation definitely causes more anxiety and depression in our population of patients that we treat. And we need to know how to help them to feel more engaged. So that's one of the things that we found to be helpful. When we are looking at our patients, we also see that they need help in terms of other areas that can help them to be more engaged in the community. And so those social determinants of health that we're identifying are helping them to be more part of the streamline and part of society.
Yeah, that makes a lot of sense. Teri, I just want to go.
Thank you. I wanted to add something. I wanted to add something that, as difficult as it is to place a loved one in a residential setting for memory care, what our residents have experienced coming from home, coming from that lonely place, not because of any fault of their family members, but because they have not had the opportunity to engage, is that they come in and there are people there just like them. They make friends. We have a daily schedule of life enrichment programs that go from 9 o'clock in the morning until 7 o'clock at night. They can choose to engage. They can walk outside. They have full freedom of walking our premises because it's a safe and secure environment, and they can do as they choose. And I think with that, it gives them that stimulation that was missing.
That definitely does. And we're at Trilogy, we're seeing a lot of the same things that we have been discussed today. People are at home, they're by themselves, they're afraid. And when our social workers or psychiatric nurses go in there, we see that this is an important topic that we need to have out there in the community so people know what's going on. Because like you said, Dr. Carline, people get lost in the shuffle. And people don't know them. I see that all the time. They'll one doctor to another town, and we don't want people to get lost in the shuffle. But for the people that are listening or tuning in, Dr. Ownby, is there any suggestions that you would have to combat social isolation or loneliness, or like what would you, based on the research that you've done, what do you think they could do?
Well, I think the most important thing is to explore what opportunities are there. When people are bored and apathetic and perhaps even somewhat depressed, they often have a very negative view of what their efforts to improve their life are likely to result in. And by that I mean, they say, well, there's no point in trying. They may be able to find things. They may have to reach out to other people. It doesn't hurt to try to communicate with family. It may be that family's not aware of how they're feeling. And certainly often elders don't want to be a burden, as they would say.
Right.
So there are lots of things like that. There may be more and more community resources for those of people who have some technological resources like an iPad, a laptop, any kind of computer. There are lots of things going on online. And I think that might be worth exploring for people. Or if you're a caregiver or a family member of someone you're concerned about, you might help them explore.
Right. Teri, do you have any suggestions, things that people could do, or does Artis offer any kind of programs where they can, because I think we talk a lot. Obviously, we're talking a lot about the people themselves, but the families also are affected by this.
I'm so glad you brought that up, Tony, because the families are suffering in a way that the doctors are describing, more so than the people with dementia, because the dementia people don't really have any sense of time. So when the families are beating themselves up for not being able to see their loved ones for months on end, they really had no idea how much time had passed. Our focus is not only on the person who has been diagnosed with dementia, who comes to us as a resident, but also on their family members. We have support groups bi-monthly, and we have very talented speakers visit once a month for educational presentations, one of which is Dr. Ownby. Dr. Carline, you'll be next on our list so that we can have you as well. It's very important for us to give that support to the family.
Nice. That's great. And Dr. Carline, you actually have a program.
I was going to mention that sometimes when we have family members, we are looking at how much dependence does the family member have in terms of the patient. So the daughter, what type of care do they provide for that particular patient? And sometimes that makes them feel overwhelmed. So there's something called caregiver burden, where the daughter or the son is trying to make their parent happy, because when they feel lonely or they feel sad, they might see a gamut of things. Maybe they're not eating, they're not doing the activities that they would like to do. And so that puts a strain or stress on the family member as well. So it is important to not only think about the patient, but also to see what's happening in the dynamics of the home and how can we help the family at whole to engage the patient and to find activities. One of the things we started doing was to try to engage our patients by showing them how to use technology. And then they can participate in our calendar of events where we have Zumba, where we have educational classes, cooking. So those are the things that we're trying to do for our patients. And because COVID-19 happened, we had to go live with telehealth. So our patients are being more and more accustomed to having these type of Zoom or telehealth type of activities. So they're participating more in them. So I think that will be one of the best ways to engage them.
That's great. Thank you. Thank you for that. Dr. Ownby, I was going to ask you, so I hear Teri saying that you definitely speak for them on their events. Do you have other events that you would like to tell us about that are upcoming where you're speaking or where you'd like people to support you?
I'd love it if anyone is in the Broward County area who's particularly West Broward or Mid Broward rather. Nova Southeastern University sponsors a lifelong learning institute, which is a regular daily schedule of classes, and I'm scheduled to speak there several times in the next few months. And then in the beginning of next year, I'm planning on doing a study of brain health programming online. So if anyone were interested in that, hopefully we can communicate some way for them to get in touch if they're interested in that brain health training program.
Got it. And then Teri, I know you always have stuff going on, so I wasn't going to list it all here today. But do you have anything in the near future that you have coming up that you'd like to share with us?
I do, Tom, and it's very exciting. Artis Senior Living corporately, we have 22 properties now up and down the east coast of the United States, as far west as Chicago, with more in the pipeline. We've partnered with experts, doctors, infectious disease specialists, and researchers from Johns Hopkins, and we formed the Artis Safety Council. We have our third meeting, town hall style, online, open to anybody who wants to join, to discuss the vaccine, the concerns, the distribution, the safety, and why the numbers have spiked. That will be December 29th at 6 p.m. If you are interested in attending this very informative webinar, just give me a call in the office, 954-990-8941.
There you go. See, right on point, right on the phone there. And then Dr. Carline.
So yeah, we have a volunteer program which we're starting for social isolation. We're including patients in this, as well as our staff members and members of the community. And one of the reasons why we're doing this is because some of the patients who are truly engaged always are asking, can we do something? Can we volunteer to help others and our peers? And so we're finding the talented both staff and seniors that can do virtual classes, dance, art, and other activities, so that develops a new niche or a new community of seniors, so that they can just log in and participate in that craft or activities during that time. So I think that has helped us to at least look forward to having some activity for the seniors, and they're actually very happy about it.
That's great. Well, listen, I just want to thank you all for your time today. I think this was a great discussion. I think we covered a lot of ground. Looking forward to the next ones. But I want to thank you, Dr. Ownby. I want to thank you, Dr. Carline. Oyadiran. See, I got it.
You call me Dr. Challenge. I told you that at the end.
And Teri Karst for providing such great information today. We really are excited to have had you on the show. Thanks for being here. And that does it for this edition of Trilogy Talks Health.
Thank you.
Thank you.
Thank you.
Bye.
Bye, everybody.